This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to the latest edition of Mon Health Live. We are getting you the information you need to know. In the last few weeks, we focused on the effort to vaccinate the populace here in Monongalia County. We're going to talk about that again, and also the concern with the variants. We'll try and explain what that situation is right now. We are joined by Crystal Atkinson, Chief Nursing Executive from Mon Health Systems. And Dr. Atkinson, good morning. Thanks for coming on.
Good morning, Kyle.
And we have a return visit from Dr. V, Dr. Archana Vasudevan, and she's with us. Dr. V, good morning. Thanks for coming on.
Good morning, Kyle.
And, of course, your specialty is infectious disease at Mon Health. And, again, that's we've talked to you a lot over the months, and your information has been very valuable, and we appreciate that. But first, let's start with Dr. Atkinson. And, Crystal, what's the situation now with the Mon Health system in terms of the number of cases? They've gone up a little bit the last few weeks. Isn't that right?
That's correct. Across the system, I mean, we're still hanging at, pretty much single digits, but again, we had a small little lull where we didn't see any cases and just starting to see a little bit of that creep back up again. Okay.
Dr. V, what's the reason for that in your mind?
So initially we were planning on rolling out the vaccinations and we were hoping it would happen at a much faster rate. And combined with vaccination delays, and in addition to that, the newer strains, and all of those have been contributing to the inching up in numbers. And our people are getting fatigued, mental fatigue, with the continuing to follow all the restrictions. So that seems to be contributing to this as well.
Mm-hmm. Dr. Atkinson, in terms of the number of vaccines, do you have an update there? The total number of those of us who have been vaccinated, and obviously part of this is kind of a public service to explain what this vaccine is and encourage people who haven't gotten vaccinated to go forth and do so.
Yeah, I think when we look at the numbers that we've been able to do, we're well over 55,000. But, it sounds like a large number, but then when we look at the populace and we look at the number of people who either haven't had their first dose or finished with the second dose, those numbers are still really low. So, again, we appreciate the opportunity to get on the call this morning and speak with you, just to be able to provide a little bit more insight for folks who may still be a bit hesitant.
Okay. I'd like to get from you both your pitch to those who may be reluctant to get this vaccine. Dr. Atkinson, what would you tell people to comfort them that this is okay and the right thing to do?
Absolutely. Kyle, as we've spoken before, I've had both of my vaccinations. My husband's been vaccinated, my two older children, and my youngest son will be vaccinated a little later today. None of us have had any type of untoward reaction, and again, this is something that I take very seriously, and I would not recommend anything to anyone else that I wouldn't do for myself or my family.
Okay. Dr. V?
I completely agree with Crystal. All of my family, my parents, my husband and myself, we've all received our vaccinations. My children are underage. My son is 5 years old. My daughter is 7 months old. When the vaccination system rolls out for children, I would definitely get them vaccinated as well. It's a very well-tolerated vaccine. Both the current mRNA vaccines are very well-tolerated. Any protection the vaccination can confer on you and your family far outweighs any side effect profile people can experience from vaccines. There is a lot of misinformation circulating among the people who decline to get vaccinated, please reach out to your providers with any questions that you have, and they may be able to help you. If I can change even one person's mind, I would take that as a victory. Please get vaccinated. You're protecting yourself and your family.
Okay, and I would think that would be the best, to use a bad cliche, the proof is in that pudding, in a sense that all the healthcare professionals that I know, certainly all the healthcare professionals we've had on this show, have all been vaccinated. Their families have been vaccinated. So I think if you're on the fence a little bit, that may be, hopefully that may be all the proof that you need. All right, Dr. V, let's take a step back real quick and explain how the vaccine works, because I think you talk about the misinformation, and part of that is some people believe that you're injecting this virus into your body, which is the last thing you want to do. That's not the case. How does the vaccine work?
So thanks for that question. We have 3 different vaccinations. One of them is on a hold right now, but 2 different vaccinations right now, which are majority of what's used. Both are called mRNA vaccines. Basically, they take a protein that is the part of the virus that attaches to human cells. And they take this protein, and it is not the virus itself. It's a part of the protein that is injected inside the human body. And your body looks at it and sees what it looks like and tells our immune cells, hey, this is what the protein of the virus looks like. Produce the cells against it, and the next time you encounter it, destroy those proteins. So that's how our body identifies the virus when it comes in. So no, you will not get COVID infection from getting vaccinated, so please do get vaccinated.
Okay. The last time you were on the show, Dr. V, we talked in depth about the monoclonal antibodies and that treatment for those who were COVID-19 positive. You had several more weeks, if not months, to build on that research in terms how that treatment works. What have you learned about the monoclonal antibodies and that type of treatment for infection?
So monoclonal antibodies, they are proteins that are produced in a lab to simulate the protective antibodies our body produces when it has an infection. It works by preventing the virus from attaching to our cells and doing its thing. The most important thing is it works best when given early. So as soon as someone gets a diagnosis of COVID, please reach out to your doctors and say, hey, do I need this medication? Will I qualify for this medication? Because it works best when given early in the course of disease. It has shown without doubt to decrease the number of severe COVID infections and decrease the number of hospitalizations and decrease ER visits undoubtedly. Even with the newer variants, which is causing a lot of panic, and rightfully so, even with the newer variants, we are using a combination of 2 monoclonal antibodies against them so that it attacks the newer variants in 2 different areas of the protein. It's really important because we continue to have all these tools in our arsenal, and we need to be able to use them. So patients have to reach out, or their doctors have to reach out and tell us, we have this patient who just got diagnosed and they need to be infused. We are doing it at MON. Timeliness is most important.
All right, so if you have COVID-19, a serious case, the earlier the better you start this treatment. And again, you found it very, very effective, right?
Very effective, very effective. Almost all of the patients we have given this to, I've not seen any of them get hospitalized.
Okay. All right. Well, again, hopefully everybody is vaccinated. If not, you will get vaccinated. But Dr. Atkinson, if you have COVID symptoms, if you believe that you have a current case of COVID-19, what action do you need to take?
Well, first and foremost, call your primary care provider, and then they can actually kind of walk you through the symptoms. If there's something that they feel like they need to have further follow-up, there's abilities for them to be able to fit you in same day. If they want to have you tested immediately, we have the tent on our campus where you can come up and be swabbed, stay in your car, and then you can drive through. Again, those results will come back. We have the ability to be able to do what's called a rapid test, and those results can be back in the same day. And then once we do feel like, if an individual does feel like that they're experiencing COVID symptoms, we would ask you to make sure that you're taking the precautions. So if you're in the house with somebody else and they're not feeling symptomatic, wear a mask in the house. Make sure that you're staying inside, you're isolating, you're quarantining to keep yourself and others protected.
Okay, and real quick before we take the break, we need to mention this. As this show airs on Saturday morning, currently going on right now as we speak, there is a walk-in COVID-19 vaccine clinic, and it's at the Greater Monongalia COVID-19 vaccine clinic at the former Sears location at Morgantown Mall. It's going on right now until 12:30, and this show normally airs at 10 in the morning. We're on in the 9 o'clock hour because of basketball coverage coming up. That's short notice, but still, as this show airs, you've got several hours to get out there and get the vaccine. You can just walk in. Dr. Atkinson, explain how this is working today, this walk-in clinic.
Yeah, so the one that's happening today, as you said, it started at 8 o'clock this morning. It couldn't be simpler. You just walk up, the registration, everything is right on site. We have 1,000 vaccine doses to be able to provide to our community. So as long as individuals are 16 and older, they can certainly come up and get that. And like I said, registration's right on site. You don't need to go to any website. Just come right on in and get your vaccine.
Okay, and again, as you're hearing this on this Saturday morning, you still have about roughly 3 hours. It's going until 12:30, so plenty of time to get out to the old Sears location at Morgantown Mall. Everybody knows where that is, and there's 1,000 doses this morning of the Pfizer vaccine that are available, so we encourage you to get out there. This is Mon Health Live. We appreciate you joining us on this Saturday morning, 104.5 FM, 1440 AM, WAJR. We will continue the conversation coming up after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Dr. Atkinson with us on this Saturday morning, and we appreciate your time this morning tuning in to Mon Health Live. Our special guest is infectious disease expert for Mon Health, Dr. Archana Vasudevan, and we talked a lot about the vaccine. And Dr. V, let's get into these variants now. We've all heard a lot about them. What do we need to know? What's the latest on the situation with the variants?
So, unlike last year, the current circulating strain in the United States is the UK strain. This is now the most commonest strain, and it has higher transmissibility by more than 50%, if that's even possible. And then we have the California strain, which is more transmissible also by about 20%. We have other strains in West Virginia and the surrounding states. Ohio has numerous cases of Japan and Brazil variant. We've had numerous cases of South African variant. A lot of these variants are circulating. And what is concerning is some of them seem to have a slightly decreased protection from the vaccinations. But the most important thing to remember is all of these strains are still preventable by the vaccine as of now. So that's why getting vaccinated is extremely important. Even though it is not showing as much of a protective factor, it still does prevent the infection. Continue to get vaccinated. The other thing about the variants to remember is if you had a COVID from a prior strain, there is a slight possibility that you can get COVID again because of these newer strains. Just keep that in mind. Talk to your providers. Reach out to us if you have any questions. Depending on what you've been exposed to, depending on who you've been exposed to, what your travel history is, we may decide to do one different type of monoclonal antibody infusion if you test positive for COVID. So reach out to us with any questions.
Okay, so you are seeing patients that had been positive previously. They're testing positive again due to these variants. Do I understand? Not everybody, but you say it's rare cases, but it has happened?
Yes, that is correct. CDC has a small report on how many patients so far have been diagnosed with repeat COVID infections. And from prior studies that have been published, usually they have a slight different genes of COVID-19 as opposed to previous infection.
Mm-hmm. Okay, Dr. V, we've heard a lot about herd immunity, and we're hoping to get there. I guess vaccines are the way to get there. Can you define that for us again, and how likely are we to get there? When could we get there?
So herd immunity basically means that a large part of a community has become immune to an infection either through a prior infection or through vaccination. With the COVID-19 or with any infection, it's important for some percentage of a community to get immune to prevent its circulation. The estimates are for COVID-19, it has to be at least 70% of our population, of the U.S. population, that needs to be vaccinated. The more transmissible an infection, the higher this percentage needs to be. Right now, we have it at 70%, and that can go up depending on the circulating variants. The more transmissible a variant, the more percentage of population has to be vaccinated against it to develop herd immunity. It's been challenging mainly because of how slow the vaccination rates have been, and there is a lot of things that's been contributing to this, including misinformation and religious reasons for not getting vaccinated. There's some skepticism about how well it would work. There is some doubts about whether it will prevent infection from newer strains. Again, I repeat myself, but it's important to remember, as of now, from the data we have, the vaccines are preventing against all of these newer strains.
Okay, so, again, bottom line there, get the vaccine if you haven't already done it. And obviously, if you've gotten your first dose, it's very, very important to follow through and get that second dose. If you've had the Pfizer or the Moderna, they require 2 doses, where the Johnson & Johnson vaccine requires just 1 dose. Dr. Atkinson, the CDC recently has come out with some new masking guidelines for those who have been vaccinated. What can you tell us about that?
Yeah, I think that one of the things that they have just pretty much put out there is they've got on their website, if you go to cdc.gov/coronavirus, there's a section there that just talks about like safe activities. Still providing a bit of caution for indoor activities, but certainly in small groups, people should start to feel comfortable that they should be able to have people over in their homes for dinner, if everybody in the party's been vaccinated, feeling very comfortable to go outside and, have a barbecue or that type of thing. But again, we still want to make sure that we are comfortable across the board, and we're making sure that we're doing the right thing. We still need to make sure if we haven't, or we're coming in contact with people that haven't been vaccinated, that they're still masking, still making sure that the mask fits well enough to be able to cover the nose and there's no gaping on the sides. Mm-hmm. And I think it's also important to make sure that we're looking at this not just from a standpoint of we're getting back to activities that we want to do, but also our personal responsibility as just a responsible member of the community. We have more than enough vaccine. We've been talking about this. We've got the availability. The age has been lowered. We all have that personal responsibility to look out for somebody else.
Yes, absolutely. All right, we're down to the final couple of minutes on the program here, and we certainly appreciate your time. This has been very informative. We want to remind you once again that there is a walk-in clinic for vaccines today. It's going on as we speak. So if you're in your car and you're listening to this, or if you're close to the mall, the former Sears location, we encourage you to go out and get the vaccine. The clinic is open until 12:30 today, and they've got 1,000 doses of the Pfizer that are available on a first-come, first-served basis. So Saturday morning, you're listening to this, and you're in your car, you're close to the mall, we encourage you to go out and get that vaccine if you haven't already. Dr. V, anything that we haven't covered that information that needs to get out?
Just one another thing. I wanted to tell people who have any kind of significant immunosuppression, especially things like blood-related cancers, please continue to mask indoors as well. We don't have adequate information on how well the vaccines protect against this specific group. It does significantly protect. Let me reiterate that. But all the same, continue to protect yourself until more data is available.
Okay, it's important just to be careful. That's the main thing. Still, the time is not to where we're back 100% to normal yet. The message is we still need to be careful in protecting ourselves and others.
That's right.
Okay, Dr. Atkinson, anything else you'd like to add?
No, I think that was a perfect way to close out the show.
All right, very good. Again, that vaccination clinic going on at the former Sears location at the Morgantown Mall. That's 9520 Mall Road. I think anybody who's spent any time at all in this county knows where the Morgantown Mall is. And again, that Sears location facing towards the Lowe's out there at the mall facility. And a walk-in COVID-19 vaccine clinic going on this morning until 12:30 this afternoon, and we encourage everybody to take advantage of that if you haven't had your vaccine. It couldn't be easier. Just show up, and they'll greet you at the door. They'll send you in the right direction and get you vaccinated. And that clinic's been as efficient as anything that I've ever seen. And I know Dr. Atkinson, a lot of work and a lot of organization has gone into that, but it's been very successful.
Yeah, a lot of great people volunteering their time just to make sure that we can get this done. So we're certainly grateful for that.
All right. We appreciate your time. Great information once again, Dr. V. Thanks. We'll talk to you again.
Thank you.
And Dr. Atkinson, thank you for your time this morning and all the way through these Mon Health Live programs.
Thanks so much, Kai. We appreciate it.
That is Mon Health Live for this Saturday morning, 104.5 FM, 1440 AM, WAJR, Morgantown. JR Morgan.